Hi, this is David Reardon with the Elliot Institute, and I wanted to talk to you about a very important study that was published today in the British Journal of Psychiatry. And it combines the results of 22 studies from 6 different countries, covering nearly 900,000 women. And it's important because it actually combines the results of all these studies in a way that's very objective and is commonly used in medical research. It's called meta-analysis, and I'll tell you a little bit more about that in a few minutes. But first, just to summarize, the key findings were that the women who have a history of abortion are 81% more likely to experience subsequent mental health problems compared to all other women. Increased risks are most significant in regard to suicidal behaviors, heavier alcohol and substance use, higher levels of anxiety, and higher levels of depression. The study also showed that this risk was higher for 3 different comparison groups. First, for women without a reported history of abortion, they were 59% more likely to have psychological issues, and that would include women who had never been pregnant, women who carried a term, just all of the women. When compared to women who give birth, they are 138% higher risk of psychological issues after the pregnancy outcome. And women who had abortions had a 55% higher risk of psychological issues following a pregnancy outcome compared to women who went ahead and carried an unplanned pregnancy to term. Here's one of the tables from the study, which I have slightly modified by indicating on the top here what the log scale is. The tables are actually reported not using a standard numeric scale, but using a logarithmic scale, which means that the spaces are different between like 1 and 2 and 2 and 3 and 3 and 4 all the way up to 10. It gets smaller and smaller, then repeats that process by powers of 10. The main thing to look at this table for a moment is just that all of these blocks are to the right of the number 1. And I'm going to go over to a quick tutorial just to tell you a little bit more about what these blocks mean and what the lines are. Those are the confidence intervals. So to give a better understanding what odds ratios mean, and also most importantly what that confidence interval is, let's look at a little example that I've created. Totally imaginary, but imagine that we were interested in the question of whether or not there's more four-leaf clovers near Dublin than there are near Boston. Different research teams might send out people to investigate, take some samples in various fields. They might get 1,000 here, 2,000 there, or whatever. But imagine that the first 2 teams that report back, one is indicating that there's about twice as many four-leaf clovers, in this case, near Dublin compared to Boston, but the other team found that there's about half as many. Now it's very important to remember here that this middle line is one for Boston. So it's normalized depending on in that study. So if there was, 10% were four-leaf clovers in Boston in this study, that would be normalized to 1. And if there was 8% in Boston in this study, this would be normalized to 1. And the count in Dublin would be compared to that count within the same study to the Boston ones. So we won't know exactly, this certainly doesn't support the hypothesis that there's more four-leaf clovers in Dublin. And it's not helped a whole lot, even though you do maybe another 4 studies. Looking at the odds ratios, we would find that 4 of the studies have numbers above 1, which indicating support for the hypothesis, but 2 have numbers below 1. So we wouldn't be very confident based on just that. If you tried to average those numbers out, that would be really a bad technique, and because each of these studies may have used different sample sizes. So that's why you need to look at the confidence interval. The confidence interval is shown by this line that goes through the dot, which represents the actual finding in the study. That confidence interval is calculated based on the size of the samples and the number of events that occurred. And it is an attempt to statistically take into account that there's going to be random variation from study to study. And it's telling us that based on this study, there's a 95% chance that other studies using the exact same techniques would find an odds ratio that fits somewhere along this line. Only 5% of studies would have a dot out here or down here away from that 95% confidence interval. Now, as we see in this sample, only this 5th study has a lower confidence interval, the lower limit, the one to the left, which is above the 1. That means this is the only study that was statistically significant. These other studies were not statistically significant because the line crossed the 1, here and here. These two studies were near statistical significance. They dipped below the 1, but the biggest bulk of the results are up here. So even though we have two studies that appear to contradict these others, these two studies, their confidence intervals overlap the 1, and they really don't tell us a whole lot by themselves. This is why we use meta-analysis. The meta-analysis combines the results of all these different studies, and because it has a larger population size, in this case field samples, combining all these field samples, it has higher degree of confidence, which means that the line going through the confidence interval is much shorter. And that's kind of the core idea behind a meta-analysis, is trying to pull all these different various studies together and develop more confidence about what the results are indicated by these combination of studies, giving less weight to the studies with real wide confidence intervals and more weight to the ones with larger sample sizes. So the meta-analysis of these 22 studies, looking at all the results, combined all the results, and down here you see a very small confidence interval, and found that it was 81% higher odds ratio. So those are the overall results. Now what's important about this combination of these studies in this way is that these different studies have different strengths and different weaknesses. Some of them are based on interviews, which are good because then you can ask questions about whether or not the pregnancy is wanted or unwanted. You can ask specific questions of the woman. The problem with interview studies is that women may deny that they had an abortion. So in many cases, 50% or more of the women who actually had an abortion will say they did not, and so they'd be put in the wrong column and be the ones that that you're comparing against. And so interview studies that's one of their weaknesses. Some of these other studies are what we call record-based studies, where the researchers, for example, linked death certificates in Finland with the population registry of all women who had abortions, which is in Finland paid for by the government, and they can track through their insurance and know which women had abortions or childbirth. And for that kind of study, you have no concealment problem. Women aren't being asked any questions, so you know if they had an abortion based on medical records, not by questioning them. On the other hand, you can't, since there's no questioning of the women, you don't know whether or not the pregnancy is wanted or unwanted or what circumstances might have been involved. So we have different strengths and different weaknesses in these various studies, and this kind of meta-analysis helps to wash some of that out, because you see this pattern is still the same. Whether the study was record-based or whether interview-based, you still see that the results are generally significant and virtually always positive, meaning to the right of the number 1 in this chart. Finally, the study looked at different control groups. Some studies compared women to all women, some compared them to women who delivered, some compared them to women who carried an unwanted pregnancy to term. So in this grouping, we see the comparison with women who delivered a pregnancy to term, perhaps wanted or perhaps unwanted, and this was the odds ratio and the confidence interval shown right here, combining all those results. Below it we see a comparison to all women who, whether they had a pregnancy or not, and again these combined results again show that the results were 59% higher risk of psychological treatment for women who had abortions. Finally, there was a comparison of the studies that looked at compared women who had abortions to women who carried an unintended pregnancy to term, and here you see that the combined results showed again that women who had abortions were more likely to have these different problems, whether alcohol, marijuana use, anxiety, suicidal ideation, depression, self-harm. These little subcategories are showing what was reported. But on average, the women who had abortions were 55% more likely to report problems. So the most notable thing about this study is the consistency in which it shows that the studies are finding higher rates of psychological problems associated with abortion, different types of problems, different types of studies, different types of control groups, but consistently the results are showing a statistical significance of problems associated with abortion. So it's that consistency, that trend in the data that is most meaningful at this time. The true number out there, if it ever could be known, would be slightly different than what's being reported in these studies, because there's a lot of variation, a lot of difficulties in the area of research. But the trend, I believe, is what's impressively shown in this analysis. One of the things that makes this study especially important is that the American Psychological Association Task Force issued a report in which it was summarized that there is no credible evidence that a single elective abortion of an unwanted pregnancy in and of itself causes mental health problems for adult women. This statement was widely reported in the media as implying that there are no mental health problems with abortion. But how is that consistent with these studies that we just saw, which are studies that were reviewed by the APA, and they could have done a meta-analysis just like what was just recently published, but they chose not to. Instead, for the most part, they went through and said, well, this study has this problem, that study has that problem, and they could always find a problem with every study, which is, of course, the case in this kind of research. There is no perfect study. Again, it's the trend in the evidence that is most meaningful. But also, when you look at this, their statement, it's a very nuanced statement. For those who are actually follow the literature and know what is being said in this kind of statement, it's not as rosy as it really sounds. First, they're saying there's no credible evidence, which means that there is evidence, but that they, in their own personal judgment, just have decided that the evidence isn't credible because of whatever weaknesses in are in the studies. There's no credible evidence that a single elective abortion. That single means that there's plenty of credible evidence that even they would admit is credible, that multiple abortions are associated with more problems after an abortion. Secondly, an elective abortion, which is an acknowledgement, again, that the research shows that women have therapeutic abortions, abortions for medical indications because of fetal handicap or because of the health of the mother, that they have more problems following an abortion than women who carry to term. Then they add of an unwanted pregnancy, which is important because a large number of abortions are for women who would want to carry to term if they had received the support of loved ones, but instead they're having abortions because it's unwanted by their loved ones and they're feeling pressured by boyfriends or parents or employers or other people to have an unwanted abortion. And those are well-known cases where women are more likely to have grief and despair, depression, anxiety, a lot of self-blame and guilt because they get caved into the pressure to have an unwanted abortion. Then the another qualifying phrase down here is for adult women. Again, acknowledging that for women who are minors, there's evidence that teenagers are more likely to have psychological problems after an abortion. So they're narrowing it down to adult women. Then finally, they're saying that pregnancy in and of itself, that the abortion in and of itself causes mental health problems. By this, they're saying that they're excluding the idea that abortion may contribute to mental health problems, and saying, well, they're only trying to look at whether or not abortion in and of itself causes mental problems. So, for example, if a woman had a history of depression and she has an abortion and her depression becomes worse, they don't want that to blame abortion. They blame the prior existing condition, basically saying the woman was already flawed and she probably would have had just as much trouble otherwise. So what we see here is a lot of qualifications, and when you look at those qualifications and properly understand it, actually the results of the APA task force are not in conflict with the meta-analysis reports here. When you break down these different subcategories that the APA is implicitly admitting have more problems, multiple abortions, for example, account for about 50% of all abortions in the United States are for women who had a prior abortion. So that means that at least half the women are at higher risk of post-abortion problems, according to the APA's own statement, which claims basically that only women with a single abortion are at lower risk. So implicitly, they're acknowledging that women with multiple abortions are at higher risk. There are studies indicating that women who feel pressured to have an abortion or are coerced that number can range anywhere between 20 and 60% of all